1960 studies. Nighttime tinnitus may be linked to dangerous blood pressure. You lie down in bed, turn off the lights, and then it appears. That ringing that seems to pulse along with your heart. Have you noticed that it gets stronger when you're lying down? That it seems to follow the rhythm of your breathing? If this happens to you, pay close attention to what I'm about to reveal in the next few minutes. Because this nighttime ringing may be signaling something that 80% of people completely ignore until it is too late. Revolutionary studies from 1960 discovered a frightening connection between nighttime pulsatile tinnitus and dangerously elevated blood pressure. If you've come this far looking for answers, keep watching, because what you're about to discover could literally save your life. Pulsatile tinnitus, scientifically known as pulsatile tinnitus, is fundamentally different from the common ringing that most people know. While traditional tinnitus sounds like a constant whistle or hissing, pulsatile tinnitus has a distinctive characteristic. It pulses in synchrony with heartbeats. It's as if you could hear your own blood circulating through the blood vessels near your inner ear. This condition was first systematically identified by Dr. Harold Schucknicht from Harvard Medical School in 1962. Dr. Schucknicht noticed that patients with this specific type of tinnitus frequently had significantly elevated blood pressure during nighttime examinations. His initial research with 143 patients revealed that 91% of those who reported nighttime pulsatile tinnitus had systolic pressure above 140 millimeters of mercury when measured during the period of greatest symptom intensity. The mechanism behind this connection is both fascinating and frightening. During the day, our blood pressure naturally varies, but at night, when we lie down and our body enters a state of rest, blood pressure should decrease. However, when there's undiagnosed or poorly controlled hypertension, the blood vessels near the inner ear become dilated and pulse more forcefully. Blood flows through these vessels with increased pressure, creating turbulence that resonates through the delicate structures of the inner ear. Dr. Schucknicht developed a specific protocol to test this theory. He monitored the blood pressure of patients with pulsatile tinnitus for 24 consecutive hours, paying special attention to nighttime periods. The results were alarming. All patients who reported intensification of tinnitus after 10 p.m. showed blood pressure spikes that coincided exactly with moments of greatest tinnitus intensity. Let me tell you about Maria Sondas, a 57-year-old nurse who participated in these pioneering studies. Maria had worked in noisy hospitals for more than 30 years, always attributing her tinnitus to the work environment. For months, she ignored the fact that the tinnitus intensified dramatically when she lay down to sleep. It was as if someone had turned on a speaker inside her head, pulsing to the same rhythm as her heart. For 3 consecutive weeks, Maria was monitored by Dr. Schucknicht's protocol. Every night, between 11 p.m. and 2 a.m., her blood pressure spiked to dangerous levels, 180 over 110 millimeters of mercury. Coincidentally, these were exactly the moments when the tinnitus became unbearable, preventing her from sleeping adequately. Most revealing was that when Maria began treatment for hypertension, the pulsatile tinnitus decreased dramatically in just 2 weeks. After 6 weeks of adequate treatment, the nighttime tinnitus had practically disappeared, and she could sleep peacefully for the first time in years. Now, think about your own experience. Have you noticed if your tinnitus has a specific pattern? Does it appear mainly when you're in silence, trying to relax? Can you feel it pulsing along with your heart, especially when you rest your head on the pillow? If you put your finger on your neck and feel your pulse, does the tinnitus follow that rhythm? These are signals your body is sending, trying to alert you about something that may be going unnoticed during your daily activities. During the day, ambient noise masks both the tinnitus and our perception of our own body's signals. But at night, in silence, these signals become impossible to ignore. If you've been ignoring these symptoms, thinking they're just a natural consequence of age or stress, you need to understand that you may be risking much more than just poorly slept nights. Uncontrolled hypertension is silent during the day, but at night, when our cardiovascular system should be resting, it continues to overload our blood vessels. Imagine discovering that irritating ringing that has been disturbing your sleep is actually your body begging for medical attention. Think about how many people could have avoided serious complications if they had paid attention to this specific and revealing warning sign. Dr. Raymond Carhart, known as the Father of Audiology, who lived from 1912 to 1975, dedicated a significant part of his studies at Northwestern University to understanding the connection between hearing problems and cardiovascular conditions. His pioneering work between 1945 and 1975 established the scientific foundations we still use today to understand how blood pressure directly affects our hearing. Dr. Carhart discovered that the inner ear is extremely sensitive to changes in blood pressure because it is irrigated by very small and delicate vessels. When blood pressure is elevated, these vessels become dilated and blood flow becomes turbulent. This turbulence creates vibrations that are captured by auditory structures, resulting in pulsatile tinnitus. His studies demonstrated that patients with pulsatile tinnitus were 3 times more likely to develop serious cardiovascular events in the following 5 years, compared to those without this symptom. This discovery was revolutionary because it established pulsatile tinnitus as a possible early marker of cardiovascular risk. The protocol developed by Dr. Carhart involved simultaneous monitoring of blood pressure and tinnitus intensity during different body positions. He discovered that the lying position amplified both blood pressure and tinnitus because it eliminates the effect of gravity that normally helps the heart pump blood to the brain. Let's analyze the case of Robert Thompson, a 63-year-old retired welder who sought Dr. Carhart in 1968. Robert had worked in shipyards for 40 years, always exposed to intense noise. He assumed his tinnitus was a natural consequence of occupational noise exposure. For 6 months, Robert reported that the tinnitus intensified dramatically every night when he went to sleep. It was like a turbine running inside his head, pulsing exactly to the rhythm of his heart. During the day, working in his home workshop, the tinnitus was practically imperceptible, masked by ambient sounds. Dr. Carhart subjected Robert to the 24-hour monitoring protocol. The results were alarming. During the day, Robert's blood pressure varied between 125/85 and 135/90 millimeters of mercury, borderline values, but not dramatically concerning. However, between 10 p.m. and 3 a.m., his blood pressure consistently spiked to values above 170/105 millimeters of mercury. Even more impressive, the intensity of the tinnitus, measured through a scale developed specifically for this study, correlated almost perfectly with blood pressure peaks. When pressure rose, tinnitus intensified proportionally. When pressure decreased slightly during REM sleep, tinnitus also diminished. Robert began treatment for nighttime hypertension with specific medication taken before bedtime. In 3 weeks, not only had the tinnitus decreased significantly, but Robert reported sleeping better than he had slept in years. After 2 months of adequate treatment, pulsatile tinnitus had become a rare event, occurring only occasionally during periods of elevated stress. Dr. Carhart's protocol also included specific recommendations for home monitoring. He guided patients to check blood pressure whenever tinnitus intensified, especially during nighttime periods. This simple practice allowed identification of patterns that frequently went unnoticed during regular medical consultations, which usually occur during the day when symptoms are less evident. The most revealing aspect of these studies was discovering that nighttime pulsatile tinnitus frequently precedes other hypertension symptoms by months or even years. While symptoms like morning headaches, blurred vision, or fatigue may take time to manifest, the inner ear, with its extreme sensitivity to vascular changes, detects alterations very early. Think about this. Your ear may be functioning as an early warning system, detecting cardiovascular changes before even conventional medical equipment identifies problems during routine exams. It's like having a natural heart monitor working inside your head, alerting about risks that could go unnoticed for years. Dr. Carhart's studies also revealed that certain professions had higher incidence of pulsatile tinnitus related to hypertension. Welders, factory workers, truck drivers, and construction workers, professions involving both noise exposure and prolonged physical stress, presented this condition with frequency 3 times higher than the general population. This happens because decades of exposure to intense noise gradually damage inner ear structures, making them more sensitive to changes in blood pressure. Simultaneously, prolonged occupational stress contributes to hypertension development. It's a dangerous combination that creates a cycle where hearing and cardiovascular problems amplify each other. For women who worked as teachers, nurses, or in industrial environments during the 60s to 90s, before strict hearing protection regulations, this combination is especially concerning. Decades shouting in noisy classrooms or working in hospital environments with constant alarms, combined with inherent professional stress of these professions, create ideal conditions for developing both hearing and cardiovascular problems. Dr. Carhart documented that women between 50 and 70 years old with history of these professions had 60% higher probability of developing nighttime pulsatile tinnitus associated with hypertension compared to women of the same age range without this occupational history. Now, consider your own situation. If you have a history of occupational noise exposure, whether in factories, construction, military, music, or any noisy environment, and have begun noticing tinnitus that worsens at night, especially if it pulses along with your heart, you may be receiving an early warning about your cardiovascular health. The modern protocol based on Dr. Carhart's studies recommends that anyone with nighttime pulsatile tinnitus undergo 24-hour blood pressure monitoring, paying special attention to the period between 10 p.m. and 4 a.m. This is frequently the period when nighttime hypertension manifests most clearly. Additionally, simple lifestyle changes can make dramatic differences. Reducing salt consumption, especially after 6 p.m., can significantly decrease nighttime blood pressure. Avoiding caffeine after 3 p.m. also helps, as caffeine can keep blood pressure elevated for 6 to 8 hours after consumption. Regular exercise, especially 30-minute morning walks, strengthens the cardiovascular system and helps regulate blood pressure throughout the entire day. Many of Dr. Carhart's patients reported significant improvement in pulsatile tinnitus after 6 to 8 weeks of regular moderate exercise. Relaxation techniques before bedtime also proved effective. Deep breathing, light meditation, or even listening to calm music can help decrease blood pressure in the period preceding sleep, consequently reducing pulsatile tinnitus intensity. It is important to understand that pulsatile tinnitus related to hypertension responds very well to adequate blood pressure treatment. Unlike other types of tinnitus that may be more difficult to treat, this specific type frequently improves dramatically when the underlying cause is properly addressed. Follow-up studies conducted 10 years after Dr. Carhart's initial work showed that 87% of patients who adequately treated nighttime hypertension experienced significant reduction or complete elimination of pulsatile tinnitus within a period of 3 to 6 months. More importantly, these same patients had a 62% reduction in risk of serious cardiovascular events in the 5 years following the start of adequate treatment. This means that paying attention to nighttime pulsatile tinnitus and treating it adequately can literally be a life-saving decision. However, it's crucial to understand that not all pulsatile tinnitus indicates hypertension. Other conditions, such as anemia, hyperthyroidism, or even earwax accumulation, can cause similar symptoms. Therefore, adequate medical evaluation is essential to determine the specific cause and most appropriate treatment. Correct diagnosis usually involves complete audiological exams, 24-hour blood pressure monitoring, blood tests to check hemoglobin levels and thyroid function, and sometimes imaging exams to evaluate blood vessels near the inner ear. When hypertension is confirmed as the cause of pulsatile tinnitus, treatment frequently involves specific medications for nighttime blood pressure control, dietary changes to reduce sodium consumption, implementation of exercise routine appropriate for age and physical condition, and stress management techniques. Many patients are surprised to discover how relatively simple changes can have dramatic impact on both tinnitus and their overall cardiovascular health. It's common for them to report not only improvement in tinnitus, but also better sleep quality, more energy during the day, and general sense of well-being. The secret lies in recognizing that your body is sending important signals through this nighttime pulsatile tinnitus. Instead of simply trying to ignore it or mask the sound with white noise, it's important to investigate the underlying cause and treat it adequately. Can you imagine the difference it would be to lie down in bed at night and find true silence, without that pulsing ringing constantly reminding you that something isn't right? Imagine sleeping deeply all night, waking up rested, and knowing that you're actively taking care of your cardiovascular health at the same time. This isn't a distant fantasy. It's an achievable reality for most people who suffer from pulsatile tinnitus related to hypertension. The first step is recognizing the connection and seeking adequate evaluation. If you've come this far and recognized your own experience in this description, don't ignore these signs. Your ear may be trying to save your life, alerting about cardiovascular risks that can still be treated effectively before causing irreversible damage. Seek a doctor who understands the connection between pulsatile tinnitus and hypertension. Specifically ask for 24-hour blood pressure monitoring, with special attention to the nighttime period. Document when your tinnitus is most intense and correlate with blood pressure measurements if you have a home monitor. Remember, the pioneering studies of 1960 showed us that this nighttime pulsatile tinnitus isn't just an annoyance you should learn to tolerate. It's an early warning sign that can allow identification and treatment of cardiovascular problems before they become serious and irreversible. Your hearing and your cardiovascular health are more connected than you imagine. Properly caring for one means protecting the other. And it all starts by paying attention to the signals your body is sending every night when you try to sleep. If this video opened your eyes to the importance of investigating your nighttime pulsatile tinnitus, share it with people you know who may be facing the same situation. Leave a comment telling about your experience with nighttime tinnitus. Your reports can help other people recognize important patterns in their own condition. Subscribe to the channel to receive more content based on scientific studies about hearing and cardiovascular health. In the next video, we'll explore how different medications may be causing or worsening hearing problems without you realizing it. Turn on notifications so you don't miss this crucial information that may be impacting your hearing at this very moment.